I feel so different now. I feel like I'm in control of my own emotions.
We can see it at home as well. We can see he's got so much better as well.
We very much try and work with the whole school community, so that's teachers, parents, young people. We can offer training and support to teachers. We can offer consultation around the young people they're concerned about. And also, working with parents is often a really effective way of helping children when they're younger. So our support is all geared toward that early intervention and prevention of mental health problems.
They're really, really kind and they're always understanding of what you need.
They help you learn so well because they're fun, but it's a good way to learn about you and your emotions.
I think it's important so we can stay happy and stay healthy.
And if you're feeling upset and you need to get out, maybe you can tell a trusted adult or some of your friends maybe.
We don't go over the same things over and over again. We'll have a little recap, and sometimes she would bring colouring pens and paper and do doodles while we talk about it.
It teaches you to just be happy, not worry about things.
Because it's someone else and they won't know about other things and you can tell them about your life.
A lot of the time we will work with the parents to provide them with knowledge and skills to then be able to go and practice those things at home with their children. We can offer workshops as well on understanding behaviour, again managing worries, those types of topics, or even understanding autism and ADHD. They could be online or face-to-face. We're really flexible depending on what that school needs and what their parents want, really.
Mrs Hammond recommended the service. She thought it would be well suited. I was initially speaking about my son rather than my daughter, but actually it turned out that both of them could receive different support. They make sure that the child receives what's going to be best for them in terms of what they need. He grew so much throughout the process. He was able to really challenge himself and understand what was going on. He felt in control of the whole process.
He was finding it really difficult to control his emotions, getting very upset. So then it was suggested to do this anxiety course. We did it with Brianna. And it was really useful to have the book, to have all the leaflets, to be able to talk to someone. She was very good that you could check in with her in between the appointment slots that we had. It really helped him sort of come to grips, I suppose, with sort of understanding why he was feeling that it was normal to feel like that and it's okay. You don't have to be happy all the time, but at the same time you can't be sort of hitting out, and it just gave him ways to rethink and to deal with it better. So it was really useful. I rethought how I was thinking things as well. I was kind of doing the things that I was already doing it, but just wording it slightly different, and then got much bigger results.
As well, her confidence grew throughout the process. She was working with the lady to be able to be more confident in an environment she wasn't, and the confidence grew not only in school but outside of school as well. I felt we were trying so many different things. It was another thing that we've tried, but actually I'm so grateful that we did, because it really complemented everything else that we were doing. And for the children to have their own space in school, in an environment that they feel really comfortable, they got so much out of. I'm just so grateful that we know about it, and I wouldn't hesitate to tell people about it. And in fact, I have told many parents in the similar situation, because we have seen the benefits.
I did get a lot of interactions with her, quite email and phone calls, and she kept me up to date with what she was doing with Harley and the plan. And then once the plan had finished, she'd send me an email with what they'd done, what they'd dealt with, how Harley had improved over them sessions. And it was good for me to be able to see the difference from when he started to when it finished.
We know that the work that we do is evidence-based. We know that it can make a difference. But when you hear about stories of families that we've worked with and how not only has that made a difference for that one person that we work with, but for the whole family,